So we're gonna, if we need to suction, do not pull the inner cannula out and then suction. Okay, why? Why is that a bad thing to do?
Pulling it all through the outer cannula.
Is it because you want to suction the inner cannula or something? Because like that would be pretty gross.
Well, it would be kind of gross, sure. What is this for?
To move any
Cleanliness.
For cleanliness?
That's what I mean by stuff like that.
Yeah.
hold it open.
Keep it open. Okay, so I pull this out, and now I'm going to suction my patient, which is bad. Okay, so if I suction this patient, now he works up a huge plug.
Oh, no, I need to change it.
Okay,
You
it's
see it
plugged.
one.
Do I have an airway?
No.
No. Okay. Now I have to pull the trach tube out, right? Start again. But if I suction with the inner cannula, and the inner cannula becomes plugged, I pull the inner cannula out, he still has an airway. Okay? So leave that inner cannula in when you suction. Okay. Even if you're in the middle of cleaning this patient and all of a sudden he's horking out all of these secretions, stick an inner cannula back in and go ahead and suction. But put it back in so that you have an airway if something should happen to that inner cannula. Okay? So important. Okay. All right. So we have everything ready to go, just about. I'm going to pull off this dirty dressing. Okay, so the dressing is full of stuff and pus and everything else. This is why we put a dressing on. Usually after a fresh trach, it'll be really bleeding, or if we've got some infection or something else going on there, he's got a lot of drainage, we'll put a dressing on. If there's nothing happening, it's nice and clean, it's dry, etc., don't put anything on it. Because what ends up happening is that dressing will actually trap secretions, moisture, and cause an infection. So if you don't need it, leave it off. But if you do need it to soak up any secretions or whatever, because sometimes they end up coughing up around the stoma, and the secretions will come out around the flange. So the dressing will help sop that up. What face you're making. Oh, yum! I haven't eaten my lunch yet. Yummy! This is our job.
Yeah.
Yeah.
I heard this is like such a big part of the job too.
It
trach care,
is.
So.
And you know, a lot of RTs kind of poo-poo it, but you know what? It is really important to keep these stomas so that they don't get abraded and eroded, and oh, it's just disgusting. It's get worse. Anyway, so we're gonna take this yucky old dressing off, okay? So I just need to pull it away. Okay, and I'm gonna put it in my garbage can over here. And because that was dirty, I'm gonna take off my glove first set. Just keep a pile going here. Okay, so now we're back to clean gloves. All right, you could have also taken the inner cannula, but I want to have a look first to see what's going on with this patient. Okay, so I can have a really good look at the stoma, inner cannula, behind the flange, what does it look like, so I know what I need to prepare. So now I'm going to get some, I'm only going to put 3 in here, into my normal saline, and I'm also going to open up a couple of gauzes as well. Okay.